Welcome to the first micro lecture of the new module. This will be our second venture into exploring specific drug groups and learning about what CNS depressants do to our bodies. We will also explore some of the regulations surrounding CNS depressants and how those drugs stack up against one another and in comparison to harder drugs. Let's go ahead and get started. To begin with, we need to break down this drug group and how they affect our bodies. In order to explore that, I first want to discuss what this CNS means. CNS stands for our central nervous system, which is the complex system of nerve tissue that controls the activities of our body. In vertebrates, it's comprised of the brain and spinal cord. So what does it mean when that system is depressed? It slows down. Reaction times are lessened, the individual is relaxed, breathing becomes easier, and the person essentially becomes sleepy. These are the medical reasons for taking the pills. We don't want to become overwhelmed by anxiety or become a chronic insomniac. So take the pill and relax or go to sleep. Unfortunately, those are really nice feelings. So everyone likes to be relaxed or have an easier time to fall asleep. So you can imagine the appeal of these drugs as a recreational drug. Some of the drugs that fall into this group are very recognizable and are often prescribed. They are often available as low-dose medications that can be increased in dosage as need be. One of the more recognizable drugs on our list is Xanax or alprazolam. It is used to treat anxiety and panic disorders. While it falls under the general category of CNS depressants, it's also considered a benzodiazepine. Xanax is available in 4 different dose strengths ranging from 0.25 milligrams to 2 milligrams. It's not recommended that a patient exceed 10 milligrams per day. As of this recording, alprazolam was the 37th most commonly prescribed medication in the U.S. It works really quickly at relaxing the patient, but it also has a pretty fast half-life. So once the pill wears off, you have to take another pretty quickly. Ativan is also an anxiety medication, but one of its main side effects is that it limits the retention of new memories. Like Xanax, it is also considered a benzodiazepine type drug. This is a short-term medication and is only supposed to be prescribed for roughly 2 to 4 weeks at a time. It takes a few doses before the symptoms of anxiety start to go away, but it is frequently used as a sleep aid in hospitals in a single dose as a sedative. Ativan is also used for the treatment of seizure disorders and epilepsy. Ativan has a longer active life compared to other types of CNS depressants, but users often experience more negative side effects compared to other drugs like Xanax. Klonopin is also used to treat seizures, panic disorders, and certain movement disorders. This drug has a high rate of suicide as a strongly negative side effect for its users, so it's not prescribed as often as the others. But the half-life of this drug is a bit longer than the other ones we're talking about here. 1/3 of users become dependent on the drug in about 3 weeks of use. This pill has a high frequency for recreational use. Other countries do not have the same regulations that we do on this type of medication, and it is often easier to get elsewhere as a recreational drug. Here in the US, it is still considered a controlled substance available only by prescription. Valium is one of the big ones for the benzodiazepine group. It is commonly used to treat a range of conditions, including anxiety, alcohol withdrawal syndrome, benzodiazepine withdrawal syndrome, muscle spasms, seizures, trouble sleeping, and restless leg syndrome. Most commonly, it is administered in pill form, but some users have been known to alter its original state of the drug to be able to feel the effects more quickly. Folks have been known to inject Valium as well as cooking it down. When injecting into a vein, the effects begin in 1 to 5 minutes and can last up to an hour. By mouth, the effects may take roughly 40 minutes to begin. Valium is so frequently prescribed that it has made it onto the World Health Organization's list of essential medicines. It's one of the most important medications needed in a basic health system. In 2020, more than 1.1 million people were prescribed Valium and on average paid about $12.88 per prescription. So it's a relatively inexpensive drug that's available for a lot of folks who suffer from mental health issues. From our short review of the individual drugs, central nervous system depressants are medicines that include sedatives, tranquilizers, and hypnotics. These drugs can slow brain activity, making them useful for treating anxiety, panic, acute stress reactions, and sleep disorders. This is great to help patients get back on track, manage their anxiety, find restful sleep, and generally improve their overall mental well-being. However, because they are so commonly prescribed to help millions of Americans, we also see an increased potential for abuse or misuse. Most commonly, we see individuals who are taking medicine in a way or dose other than was prescribed. They're being caught taking someone else's medicine, or they're taking the medicine for the effect it causes, basically to get high. As these drugs are sometimes overprescribed, it is easy to sell the extras for money or just to use them recreationally. Additionally, these drugs are problematic as it does not take long to get dependent on them. Some take as little as 3 weeks to a month before dependence set in, and that's a relatively short amount of time. In addition to the dependence issues, we also see severe withdrawal symptoms. Withdrawal can result in death, seizures, and mental impairment. Withdrawal often needs to be monitored if the individual is considered really dependent. Although not as frequent, it is possible for individuals to overdose on CNS depressants. Remember that an overdose occurs when the person uses enough of a drug to produce life-threatening symptoms or death. When people overdose on a CNS depressant, their breathing often slows and stops. This can decrease the amount of oxygen that reaches the brain, a condition called hypoxia. Hypoxia can have short and long-term mental effects on the central nervous system, including coma and permanent brain damage. More commonly, when overdoses happen with these medications, they are accidental in nature. Most people take too many pills or drink while they're using, and their bodies just start to slow down. But it's not a violent overdose or anything like that. People just go to sleep. Remember that these drugs are supposed to depress the brain functions. If you take more of the drug than is recommended to the point of overdose, your brain will stop functioning. You will stop breathing. This is why monitoring is so important, because of the dependence level. So how do you think that doctors actively monitor these meds? Short prescriptions. If the drug has a high frequency of dependence, then don't give someone the opportunity to develop that dependence. But the issue comes from what we were just discussing before. High amounts of prescriptions are being written, some level of self-medication is occurring, and some level of recreational drug uses as well. Then you have people who aren't taking the drugs as prescribed, or they're even mixing things together, which results in the dependence and possible overdose. This was just a short introduction to the effects of CNS depressants and an exploration of the most common drugs that are prescribed in the U.S. In our next micro lecture, we're going to look at the history of CNS depressants and how one group in particular, benzodiazepines, have taken a strong foothold in our daily lives. I'll see you back here for that micro lecture.